first start IV insertion, you have to gather your supplies. So a lot of places have your IV start kit, but a lot don't. So that means you have to critically think. You're gonna need a tegaderm. It needs to be clear so you can date and time it when you're finished. You need some sterile alcohol prep. Some facilities require you to have chlorhexidine. It looks like a stick, you just snap it and use it, okay? Next, you need a saline lock, or it's gonna bleed all over the place. Next, you need your IV, and there's all kinds of different styles. They've got butterflies, they have regular, they have the ones with the safety thing on there, the ones with don't, but the concept is the same. Gauze, tape, flush. Now, if the facility likes to have one of those J loops, the tails on there, then that means you're gonna have to flush it first. Make sure you always get the air out of your flush. And you flush.
You're wearing gloves, right?
Yeah, I'm wearing gloves. Right. I'll put some gloves on.
No, just say you're wearing gloves.
No, this is not the right lock. They put the wrong lock in the kit. Sorry. Let's do this. Make it clean.
It's fine, I can edit the video.
It's perfect. It's just for us.
I'll edit the video.
No, I was just saying, say you're wearing invisible gloves. I try not to waste supplies.
Right.
Someone's like, I'm wearing invisible gloves.
Here's the right one. So when we open up the cap, it should have, this is a female cap, which means that you can insert in it. Make sense? So I always make sure I flush it. Just get a little drop at the top. That way when you hook this up to the IV and actually flush, you're not pushing air into your patient, okay? So I'm gonna put this on the clean gauze right there. All right, the next thing you need to do after you gather your supplies is you need to check your patient. So you gotta obviously check the ID, do all your safety stuff, make sure your patient knows that you're looking around and find the appropriate vein and that your tourniquet is going to be tight. The key is to have the tourniquet tight, especially if their veins aren't as prominent as like right here, okay? They're super small. So that means your elderly person is gonna be very tight for them. So make sure that you put your tourniquet at the top of the arm. We try to go as distal as possible. If it's an IV insertion that's gonna be in there a while, try not to use the bend if you don't have to, okay? You can also use the hand and listen to your patient. Your patient generally knows if they've gotten a lot of IVs where the best spots are, okay? So next, kind of look around. This one looks like a really good one. This one looks like a good one, but I wanna see what it looks like when it's full. So when you pull your tourniquet up, you are not making a bow. This is not tying your shoe. So pull it really tight and do a tuck. Notice I didn't bring the whole thing through, okay? You just got a little tuck here. Now the purpose of that is so you can, when you need to, just pull it out. Okay, perfect. All right. Round and tuck. Got it? Next, you're gonna clean, look for your area, right? That means you feel. Don't just rely on sight, okay? Don't be the nurse that takes the tip of your glove off to feel around. Get in the habit of doing it now with your glove on, okay? So we're gonna feel around. Okay, this looks like a good one. I'm gonna pop this so I can clean the area. I'm not impeding my patient the whole time. We're gonna circle out. That air dries. You do not blow it. You do not wave your arm on it. You do not smack it. Oops. We're gonna put this back on. It should be dry by now. Gonna get my IV.
The garbage can I get? I don't know why we didn't have one in here.
Thank you. All right, so now look at this. There, right here is a guide. See it sticking up right there? That means you'll be able to slide the catheter in because the needle doesn't stay, correct? Mm-hmm. So the next thing you're gonna do is make sure you pull the skin taut. That opens up the skin layers so that the puncture is not so hard on the patient, okay? Pull the skin taut, go in, go down. You should get a flash, see the pink flash? And then guide it up, pop. Oh, it's not gonna stay in because it's not a real person. We got blood. This is ready, right? Because you got it ready. Now you're gonna assess the site while you're pushing. Make sure that everything's good. No swelling, no edema, no pain from the patient. Okay, perfect. Now it's nice and locked. You gather your tegaderm, and my stuff is sticking to me. Peel. Nice and clean. This helps prevent infection. Take your paper off. And then you date and time this. And you stick it on it. Don't stick it over top of where you need to assess every time you look at the IV. Good.
Okay.
All done.